Good afternoon. I'm Dr. Jazz Atwal, Manitoba's Deputy Chief Provincial Public Health Officer. As of 9:30 a.m. today, 145 new cases of the virus have been identified. This includes 91 cases on July 1 and 54 cases today. There are 1,147 deaths due to COVID-19, and the current 5-day COVID-19 test positivity rate is 5.4% for provincially and 4.8% in Winnipeg. Today, I'd like to talk a bit more about B16512, or the Delta variant of concern. As of Wednesday, June 30th, there have been 217 cases of the Delta variant identified in Manitoba since late April. The Delta variant has now been detected in every regional health authority in Manitoba. The majority of cases to date have been identified in Winnipeg, 40%, followed by Southern, 29%, and then Northern, 24%. 14, or 6.5% of these cases were travel acquired, and 131 cases, or 60.4%, were close contacts of a known case. This is nearly 3/4 of all identified Delta cases to date. 187, or 86.2% of these cases were either not immunized before their infection or only had a single dose and were infected less than 14 days after their first vaccine dose. We do acknowledge some of these individuals may not have been eligible to be vaccinated. They may have had an appointment that came after they were infected or had barriers to access the vaccine. We do know that the Delta cases have been increasing in number, and that is not unexpected. The head of the World Health Organization has said the Delta variant is the most transmissible of the variants identified so far and warned it is now spreading in at least 85 countries. But there are things we can do to protect ourselves and others. New analysis by the Public Health of England shows for the first time that 2 doses of COVID-19 vaccines are highly effective against hospitalization from the Delta variant. Getting vaccinated will help prevent severe illness from this variant, and continuing to follow the fundamentals will help protect us even further. We also need to take steps to protect ourselves from heat wave that hit the western parts of the country earlier this week and now has arrived in Manitoba. We are seeing temperatures in the mid-30s in many parts of Manitoba. These high temperatures are expected to continue for a few more days. Heat can have serious effects on people's physical health, mental well-being, and cognitive ability. However, older adults, people with chronic illness, people living alone, infants and young children, and people who work or exercise in the heat have a particularly high risk of heat illness. Heat illnesses are preventable. Be sure to take care of yourself and others. Remember to drink plenty of water, wear loose-fitting, light-colored clothing, wear hats and use sunscreen, and take cool showers or baths. Public health orders allow municipalities to repurpose facilities such as libraries and community centers as cooling centers for vulnerable people who may not otherwise have means to cool off during the heat wave. Outdoor pools, splash pads, and wading pools are operational at this time. The orders also allow the operation of outdoor pools, splash pads, and wading pools at hotels, campgrounds, and other private businesses. People attending these facilities must be reasonably able to maintain a separation of at least 2 meters from other members of the public. It is expected that all facilities will have required supervision, and efforts will be made to ensure the public follows proper physical distancing and public health protocols. Please note that these services are available for those who do not readily have heat relief available to them. So if you have air conditioning, a pool, or a sprinkler at home, the community pool or splash pads are not to be used as part of a family outing. Further information about heat and your health can be found on the Manitoba Public Health website. All people aged 12 and up are now eligible to make their first or second dose vaccine appointment. The date of the second appointment must be at least 28 days after the first vaccination. Individuals can book online at protectmb.ca or call 1-844-626-8222. When people get vaccinated, the community spread of the virus is reduced, which means fewer cases, fewer hospitalizations, and fewer deaths. We protect those around us, even those who cannot get vaccinated for medical reasons. We also see restrictions lifted and life getting back to normal, even just a little. So make your vaccine appointment today. Thank you. And now I could take questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CTV Winnipeg, Devin.
Good afternoon, Doctor. First question just regarding vaccine uptake, and it has been well so far, going well so far throughout the province. Do you have any concerns, though, about a spike in cases due to Canada Day?
So just the last couple of words there.
Sorry, just if you, with the vaccine uptake, are you concerned about a spike in cases due to Canada Day?
Yeah, you know, I think we have the public health restrictions in place. I think, again, most Manitobans are following those restrictions, so we have limited those indoor activities. I think for Canada Day, you know, a lot of people were out in smaller groups. They were outdoors, and they were, from what I saw and from what I've heard, they were following the orders throughout the province as well. You know, we have a lot of vaccine out there. We're continuing to dose people, first doses and second doses, and we're approaching 75% on the first dose, and we're closing in on 50% for the second dose. It's really hard to predict if we're going to see that spike in cases. You know, people will be interacting, so we know interaction can generate cases. You know, indoors more risky than outdoors, and outdoors the greater number of people you interact with, even then, you know, there is a slight increase in risk as well. So it will be something we'd have to look at in detail, and I think the only way to know is to see what happens in the next week or two. I think we're going to continue to see a decline in cases. Right now, our trailing 7-day average for cases is roughly 77 cases, so that was a 20% decline from last week to this week. And I think we're going to continue to actually see that week after week. So that's what we're hoping for. That's what we're expecting. We might see a small bump up related to, you know, Canada Day, maybe some of the activities. But again, with that vaccine uptake, that helps prevent transmission chains from happening. And also with that, you know, I think people have been following the orders, and businesses have, and people have socially as well.
Thank you. And my second question here just regards to your comments about the Delta variant a little bit. You mentioned that southern Manitoba seems to have, but it also seems to have the lowest vaccine uptake. Do you know if there's any extra plans to get more vaccines into arms in southern Manitoba to help prevent that spread of not just COVID, but the Delta variant as well?
Yeah, so, you know, we've talked about the Delta variant before. You know, we've talked about vaccine uptake and what the vaccine task force is doing, what we're doing from a public health perspective in relation to vaccine uptake, you know, reducing stigmatization of it, making it more accessible for people, working with local groups and leaders all through the province, even in Winnipeg, Northern Health Authority, Southern as well, Prairie Mountain and Interlake Eastern, to get vaccine closer to people, to educate individuals on vaccine, and to really, you know, increase our vaccination numbers. So we do know that in areas or in pockets where perhaps there is less vaccine uptake, that risk of infection spreading is greater for sure. You know, we've seen that happen. But we are working closely with all stakeholders to improve vaccine uptake. And I think we're seeing the benefits of that. You know, we're seeing our first dose increase happening, our uptake of the first doses, and our velocity, the amount of second doses coming out is amazing as well. So we're going to continue to work with, again, those community members, those leaders, the representations from different populations throughout Manitoba to continue to promote vaccine uptake.
From the Winnipeg Free Press, Danielle.
Hi, Dr. Atwal. Have you completed the epidemic models that would account for Manitoba's reopening plan, vaccination, and the Delta and Gamma variants?
Yeah, so the modeling with the Delta variant built into it is still being produced. So that isn't finalized yet. It does take time to generate these mathematical models. There's a lot of variables involved, and adding in one variable that has a number of different impacts on other variables does take some time. So that work is still underway. So we do know from other jurisdictions, 2 doses of a vaccine 2 weeks past that second dose really has limited impact on case generation and on severe outcomes related to hospitalizations and ICU stays. So we know 2 doses will be 90% effective roughly against the Delta variant. What we see in our ICUs right now, so from June 21st to June 27th, again, this isn't about blame, but this is about what's happening in our hospitals. We had close to 60 hospital admissions. 80% didn't have a vaccine. 0 doses of a vaccine. We never had anyone with 2 doses of a vaccine being admitted to the hospital during that week. Out of that, even from the ICU perspective, 85% of people admitted to our ICUs during that week never had a vaccine dose, and no one with 2 doses was in the ICU as well. So we have local data that supports how effective, how powerful that vaccine is to protect yourself from getting into a hospital situation or an ICU situation or passing away from the virus, but also how it could protect, your family, your community, and how it protects Manitoba's healthcare system as well. So again, we need to look at that. We really need to understand it. And if people are vaccine hesitant still and an ongoing, again, the people you trust with your health problems, if you are a cancer patient, if you're a diabetic, or you have high blood pressure, you have a mental health issue, you seek out care through primary care. Seek out vaccine information from them. Ask them, question them about vaccine questions, and work through your hesitancy with them. That would be the most powerful thing you could do.
So we are approaching our next vaccination targets for reopening. Can we confidently move forward with that next phase without those projections, or will they be necessary for the decision-making of you and your team?
We're going to take a look at all of the information, all the data that's available to us when those decisions are made. We have a goal here of hitting 75% first doses, 50% second doses before we look at that second reopening. And we're going to hit those targets, it looks like, in a shorter period of time than anticipated as well. Again, we're not going to jump to anything. We need these orders in place for about 2 weeks to see our case numbers, to see, some more vaccine effectiveness information for Manitoba. Hopefully a model is done by then as well, and we're going to take into account that information as well. So we're going to take a look at all of the information we have and come to decisions that are best for Manitoba and best for Manitobans.
From Global News, Shane.
Good afternoon, Dr. Atwal. Thanks for taking our calls. I've been curious a little bit about the Delta variant. Specifically, our numbers seem pretty low compared to other jurisdictions, but when we look at the numbers, there's more than 8,000 unspecified VOC cases. So I'm wondering if you could kind of outline how the Delta variant is confirmed, whether it takes a little bit longer, and might our numbers be higher, and like a lot of those cases now unspecified will turn out to be Delta, if you know what I'm asking.
Right. So, all along with testing, and as, variants of concern developed, we started changing our testing process a little bit. So, we initiated variant of concern screens, and we were also starting to sequence samples a few months ago as well. So sequencing is sort of that gold standard. It takes a lot longer to do that versus a screen. So, for the past period of time, a number of months, all of our samples have been screened for an alpha, for a beta, and for a gamma variant. So that means those samples would be one of those variants. The remainder were, in essence, other types of variants, and there's hundreds of other types of variants out there. There's specific variants that, like a Delta variant or a Kappa variant, there's Epsilon variant, there's hundreds of different variants out there. So what happened is once those screen in for an alpha, beta, gamma, what's remaining, the vast majority of them were being sequenced. Not all of them, wasn't 100%, but whatever could be sequenced was sequenced. And reasons for not sequencing something was if we didn't have enough sample of the virus left on the test. So from those results, we were getting the numbers of Delta variants we have right now in the province. So that gives us a very accurate picture of what's happening with the Delta variant in Manitoba. Yes, some of those numbers are a week old. Some of those results are maybe even 10 days old because sequencing does take a number of days to occur once it's received into the lab. We were delayed in getting the Delta variant here as well. Our third wave hit much later. The Delta variant arrived much later here in Manitoba than in other jurisdictions. So in some ways, getting more vaccine out early, provides some of that protection against the Delta variant as well. And going forward as well, so starting next week, we're thinking on Tuesday this should be operational where all of our samples, as right now they're being screened for alpha, beta, gamma, we're going to be able to screen for the Delta and the Kappa variant on top of that. So we'll be screening for 5 different variants and getting an answer much quicker in relation to Delta cases in Manitoba or Kappa cases. And those would be considered the Indian variants or the B16172 and the B16171 variants as well. So starting next week, we'll have a better real-time sense on those numbers. So instead of having a 7 to 10 day delay, it'll only be a matter of 48 hours or 72 hours before we get those screen results back. So going forward, we'll have better numbers in a quicker amount of time related to the Delta variant as well.
Great, I appreciate that. And so, and I guess I'm wondering now then if we do have a quicker turnaround on those Delta numbers and we do see maybe an increase, how much of a factor the Delta variant numbers would have in plans to further reopening during the summer.
Yeah, so we've talked about this as well. So we know those who are vaccinated, if you're fully immunized, you still might get an infection. Vaccine effectiveness isn't 100%, right? So let's say it approaches 90%. We also know that if you do end up getting an infection, even if you're fully immunized, when you're fully immunized, that your risk of a severe outcome is still much less. It's much less risk of a severe outcome in those fully immunized versus not being immunized at all. So, case generation is going to be one variable we look at, but the impacts on, net new ICU admissions and net new hospitalizations per day is going to be important as well. It's almost going to be more important than just the cases that are being generated, because we know a lot of those cases now, yes, they were cases, and if they weren't vaccinated, we know a certain number would end up in the ICU. Now, once they're vaccinated, they might still end up being a case, but the risk of ending up in an ICU or hospital is much less. So, the Delta variant will play a role and how much of that is circulating in Manitoba in relation to our reopening plans and strategies and thoughts. But again, it's we're going to have to wait a little bit here. We're going to have to get more information, look at more indicators. And it's not just the Delta variant, but it does play a role in our reopening thoughts and the data that we look at in relation to where we're going to take Manitoba next.
From CJOB, Rosanna.
Hi, Dr. Atwal. Thanks for taking our questions. I know you mentioned the models are still being worked on, but can you share any information on what we can expect for the fourth wave's timeline here in Manitoba? For example, when it will start?
Yeah, I mean, it's real hard to predict that future. So are we going to see somewhat of a wave in the fall? I mean, we're going to see something, and we're going to have extra cases being generated. The seasons are going to change. People will be interacting. Coupled with that, we're going to see other viruses as well. So it's not going to be just COVID, but we're going to have, influenza. We're going to have RSV. We're going to have rhinovirus. There's going to be lots of other viruses circulating as well. So it's too early to somewhat talk about the fourth wave. We do anticipate, viruses will be impactful to Manitobans in the acute care system in the fall. I think what we need to focus on is how to prevent COVID cases from generating, how to prevent that fourth wave from being a large wave. We want to be able to manage whatever cases are developed, and the best way to do that is to get 2 doses of a vaccine. That will prevent COVID cases, so the acute care system isn't overwhelmed by COVID, and it can still manage all the other viruses that still require hospitalizations when those seasons come, and then the acute care system could also manage all the other work that it needs to do as well. Yeah, I know everyone wants to talk about a 4th wave. We're at the beginning of July here. It's July 2nd. We still have a number of phases to go through here, and a lot of things could change in that period of time as well. So let's focus on what we need to do next. And what we need to do next is still get more Manitobans vaccinated.
Thank you. And what factors are you considering in your decisions to bring back our out-of-province ICU patients?
So from an ICU perspective, I believe there's still 6 patients out of province in ICUs in Ontario. They are slowly being repatriated back. Some ICU stays are longer, some are shorter. We mentioned in the past that, some 50% of ICU patients will be out of the ICU within the first 7 days of coming into it if they're there for COVID. It takes another week for another 25% to get out. That means another 25% are sort of long stays within the ICU. So they might take a few weeks before they're out of an ICU situation. So I know work is done by Shared Health, and they're talking every day. I think they talk once or twice a day with our counterparts in Ontario regarding all of these patients, and they're doing their best to bring people back home, but they also want to make sure that it's safe to bring them back home. So that work will be ongoing.
From the Winnipeg Sun, Josh.
Good afternoon, Dr. Atwal. Josh Aldridge, Winnipeg Sun. We've come off a few days with 1 death or no death. What should we read into 7 being announced today? I know it's cumulative over the last couple of days, but is there a reason why we're seeing 7 announced today as just catching up with that lag? Also, there's an unspecified variant of concern that 1 death is linked to. Why are we unable to link it to a specific variant? Is that still being investigated, or is this a new variant outside of the 4 main ones that we've talked about previously? What can people make of that?
Yeah, I'm sorry, I don't have the details on that. So yesterday was a holiday. Today there was a bit of a data issue, so we were just getting some of our data before I came out here today. So that's something we'll have to take back and provide an answer to you for.
Okay. My follow-up is, you talked about the things that we need to do in these next couple phases that we still have left to get through before we're looking at a 4th wave. But are you concerned about the first dose uptake slowing? It has slowed considerably. It is still going up, but it has slowed considerably. And is there the potential for a regional approach if these areas where there's 20-25% uptake on vaccines, if they're dragging down the rest of the province? Is there a potential for a regional approach to take place to opening up? Or is it just everybody's in one boat at this point?
Yeah, in relation to the first dose slowing down, I don't think it was unexpected. It was expected, and it's what we anticipated. And the second doses, the velocity is very high. How many people are booking appointments for second doses is very high as well. So on the first dose side as well, we've introduced that distributed model. So there's clinics and pharmacies and physicians all around Manitoba who are able to provide some of these doses as well. We've got a lot of outreach happening in various communities with workplaces to get more vaccine out and specifically get more first doses out. And I think we saw some, when some of those initiatives took hold, we saw some, greater numbers of people getting first doses just because from a convenience perspective, from a culturally safe perspective, or from a number of different reasons people were getting that vaccine and getting that first dose and getting educated about the vaccine if there was hesitancy. So we're going to continue to do that, and I think our numbers will continue to climb. Our first dose numbers on a percentage basis or on an absolute basis won't climb as well as the second dose numbers, just where we're at in relation to the vaccine rollout as well. So in relation to the second part of your question there, in relation to reopening strategies and if areas are, have low vaccine uptake, we do have to take that into consideration. We've used different tools in our toolbox in the past. So anything is possible in relation to that as well.
From CBC Radio Canada, Charles.
Hi. You said that new public health studies from England found out that individuals given 2 doses of the vaccine should be protected from hospitalization caused by the Delta variant. Besides hospitalization, how concerned should fully vaccinated individuals be over the variant?
So, people should still be concerned. So even if you're fully immunized, there is that risk of getting that infection. There seems to be a little bit of a perception, I'm fully immunized, I don't have to worry. Well, you still do have to worry because there is still that risk of getting the infection. And there is still a slight risk of a severe outcome, but you've really reduced your risk down substantially, almost exponentially compared to not being vaccinated. So that's all good. What we also want to do is sort of limit those transmission chains. So, practicing the fundamentals is still important. So even if you are fully vaccinated, you still need to listen to the orders, adhere to the orders, and follow the orders, and try to limit those interactions with others. If you're sick, you should still get tested. Stay at home until that test result comes back, and your household should still stay at home until that test result comes back as well. We need to continue to limit our transmission chains. We still need to be vigilant with the virus, and the virus has an impact on the acute care system as well. So even if you're fully immunized, yes, you are greatly protected. Your risk of a severe outcome is much diminished. Your risk of going into a hospital is almost zero. It is substantially better. But if you end up being a case still, so you could still end up being a case, and if you're interacting with people while you're sick, or if you don't get tested, you could be spreading that virus and introducing virus to other people, creating other chains as well. So we still need people to practice the fundamentals. We still need people to listen to that public health messaging.
And many gatherings occurred yesterday in Manitoba. Do you think those events will have effects on the number of COVID-19 cases?
Yeah, so the orders do allow for gatherings outdoors. So on the private side, 10 people outdoors, in public spaces up to 25. I think Manitobans have really done a great job in relation to following the orders. I think the weather is very allowing people to really adhere to the orders a lot more right now as well. It's hot and people want to be outdoors, and you're still able to socialize, you're still able to get together, and you're still able to see those loved ones and your friends that you haven't seen for a long time in a safe way. So I'm still anticipating a drop in cases. We had a 20% drop from last Friday to this Friday on a trailing 7-day average. I think we're going to continue to see that drop. Is it possible to generate more cases out of what happened on Canada Day with all the gatherings that people had? It's possible, but I'm still anticipating people were adhering to the orders, and I'm anticipating another 20% drop for next week as well.
Thank you.
Our final reporter this afternoon from CBC Manitoba, Bart.
Good afternoon, Dr. Atwal. We've had, just more on the deaths announced today, we've had throughout the pandemic here the second highest case fatality rate in Canada among the provinces, and the second highest per capita fatality COVID rate among the provinces. I know, as you're well aware, we had a brutal second wave, we had a brutal third wave, and there was a policy earlier of trying to stick to the least restrictive restrictions possible as a general policy. Given what you learn now, when you guys are doing your post-mortem on your pandemic book and on your public health playbook, and you're starting to put, I know work is underway as to figuring out what to do for future waves and for future pandemics. Are you going to toss that? Is it time to just say, to approach more of the COVID zero approach that was more successful in other jurisdictions in Atlantic Canada, small island nations? Can we just, with the benefit of hindsight now, say that we're going to focus on more of a COVID zero approach?
I think looking back, people look at this COVID zero approach, and it does have some merits to it. It does work in some circumstances, but the places that put it into place, they still have issues. They still have lockdowns occurring. So they have large percentages of the population still being impacted. So it's still impactful. So anything that we do from a public health perspective is impactful on health, because it's not just about someone dying, it's also how does it impact their social health, their mental health. The Atlantic provinces, obviously their bubble did break to some degree, and it broke, at different times. Did they have the same number of cases and deaths on a proportionate basis compared to other jurisdictions? No. But they had significant impacts related to the lockdown, related to other things like mental health, related to social well-being and other things as well. So it's a fine balance, and it's challenging. Let's face it, this is challenging. Our acute care system did get overwhelmed here in Manitoba. Proportionally speaking, our acute care system was more impacted than any other province. Why is that? So we are looking into that. There's work being done at the federal and provincial level to understand the dynamics related to that as well. So the COVID zero approach won't work at a small local level. I mean, it has to be at a grander level, but there are, again, implications and unintended consequences related to that. So if you look at Australia, their vaccine uptake is very poor. And how will they ever get out of their bubble, per se, even though they've had to lock down, within that bubble and many times, and I believe they're still in lockdown in major parts of Australia as well. So it is challenging. I think looking back, there's always going to be lessons learned. We are applying some of the lessons that we've learned every step of the way. So it's not like we aren't learning. The virus was there, the virus changed, and we're adapting to it as well. Again, we have some great vaccine uptake in Manitoba, and we need to continue to focus on that vaccine uptake to, again, prevent, cases and severe outcomes as well.
Hey, this is something really interesting there. You're trying to figure out why healthcare system was impacted worse than anywhere else. I'm assuming you're saying that's over and above the fact we had a tremendous number of cases. So we've had the Premier muse about a month ago that there were demographic reasons that we had more COVID fatalities. He walked that comment back the next day and said he misspoke. So what's your theory as to why we were so heavily impacted?
Yeah, I'm not going to, raise any speculation here. Like, the work's being done. So we're going to analyze that information. We're going to look at the information on who was a severe outcome, who got hospitalized, who ended up in the ICU in Manitoba. And we're going to provide that information with other provinces as well and try to understand that entire issue for other provinces as well, and for Manitoba. So why was that more impactful in Manitoba on a population level, on a rate perspective, at a population rate perspective as well? So that's going to take a lot of time, because it means reviewing all the cases. It means getting together with all these other jurisdictions to understand definitions and to review all the data. And you want to be accurate with that data as well. So I'm not going to suppose on anything. I think we're going to wait for that report, and then we could review that report.
Thank you, Doctor. This concludes today's media briefing.